Okay, there you go. Welcome everybody as you trickle in. We're going to allow for a minute or two for all the folks who have registered. I know that there's quite a few folks who registered, and I thank you for that. We're going to have a good evening today or tonight. Good evening tonight. Good evening tonight. All right, so now we are live on Facebook, and obviously folks are going to keep trickling in over the next couple of minutes probably, but I want to welcome all of you. My name is Gustavo Rivera, State Senator for the 33rd District in the Boogie Down Bronx. Got to throw up my X. And Chair of the Health Committee in the Senate. I welcome you this evening for a conversation about vaccinations, about all sorts of questions that you have about vaccines. But first of all, para aquellas personas que hablan español, sepan que tienen la oportunidad de escuchar todo esto en español. Abajo en su pantalla hay un botón que dice Interpretation, y usted le da a ese botón y podrá escuchar todo esto en español. So just wanted to make sure that for those folks who have just tuned in, who are Spanish speakers, that we actually they know that they have that interpretation button at the bottom of your screens. De nuevo, si habla español, dele al botón de Interpretation y podrá escuchar el resto de esta presentación en español. So thank you all for joining us this evening. We're going to be we're being broadcast live on Facebook, and we want to make sure that we get through. We're going to have a lot of questions this evening. First of all, I want to thank Let's Get Immunized New York, a campaign for your invaluable cooperation on the vaccine outreach effort, and certainly on helping us put this together this evening. And we have we have some great panelists that Let's Get Immunized New York made available to us. Some of those are folks who are longtime allies of my office. We've done a lot of work with them. Some we're just getting to know, but all of them are great. I'll just introduce them quickly. Dr. Sumir Sagal from Essen Medical. He's the Chief Medical Officer. Dr. Sagal, welcome. We're also joined by Dr. Barry Zingman, who is the Medical Director at the AIDS Center and Clinical Director for Infectious Diseases at the Moses Division of the Montefiore Medical Center, and also a Professor of Medicine at the Albert Einstein College of Medicine. We are joined by Betsy Morales Reed, who is the Senior Director for Health Initiatives at Hispanic Federation. Also by Lorraine Braithwaite Hart, who is the Health Chair for the NAACP New York State Conference. And last but certainly not least, Dr. Jay An, who is the Chief Medical Officer for Union Community Health Center. And I certainly want to thank also our interpreters, Marian Casas and Raul Carrera. Thank you so much for helping us out this evening. So, and I'm going to introduce the different panelists as they speak, but I wanted to do some introductory comments here. Now, first of all, we are still in the middle of this pandemic, so please make sure that you remind yourself of that. We have, positivity rates in the Bronx are still high, and in many places across New York as well. And I know that folks are joining us not only from the Bronx, but from other places. So there's things that you can do to slow the spread. So make sure that you stay home if you are sick. You can wear a mask if you go out. Keep 6 feet between you and other folks as well. Wash your hands often, particularly when you interact with things outside of your home, and get tested often. It is free and it is available, and certainly also confidential. There's a bill that I passed to make sure that any contact tracing information is confidential. So you can share that information without fearing that it might land in the wrong place. But bottom line is that we're still in the middle of a pandemic, and there's much that you can do to make sure that you remain not positive for this disease. And as far as my office, I just want to say briefly, our office remains closed physically, but we are open and we are working. My team is working remotely, as we have been for most of the last 10 months. And you can reach my staff at 718-933-2034. The number and the email is right there, grivera@nysenate.gov. and that is the way that you reach. You can call me, you can leave a voicemail, you can send me an email, and these are the simplest ways to contact my team. Now, tonight we're going to have a conversation about the COVID-19 vaccine. As I said earlier, I'm the chair of the health committee in the Senate, and I take this very seriously. The idea that we need to make sure that we distribute this, this vaccine, that we distribute it quickly, but that we provide as much information as possible so that folks have the information, because there's a lot of questions out there. I understand that there are, and I've been hearing from community members that there are questions about how the vaccine came about, how does it work, when is it available, is it safe, all of these things. And I wanted to make sure that I brought together a panel of experts who knew who do this for a living. This is what they do, right? And they're trustworthy partners in our community. They've been doing work in it for a long time. So these are folks that can be trusted. And I wanted to make sure that we brought all that together in a place where you can get this information, so that it's available to you and to your family and to your community. Now, just for those of you that are from the Bronx, actually, just make sure that, if you want to, tell us in the chat where you're from, maybe over there on Facebook, if you want to tell us a little bit of where you're from. Again, I'd love to see folks from the Bronx, but I know that there might be folks tuned in from other places. I see some Norwood, and some more folks are going to come. Originally Bedford Park. Lots of folks from the Bronx are here. So thank you so much for being a part of this evening. And you should know as well that, if you don't live in my district, by the way, we will answer all sorts of questions about the vaccine. There might be some issues that you have that might relate to your particular state senator, but we will make sure that we connect you to your state senator for assistance. And so when we get to ask questions, and if you have things that are more specific to situations that you have and you don't live necessarily in my district, we'll make sure that we'll connect you with the right folks. Now, so to talk about that, so as far as vaccines, this is the way that we're going to do it. We're gonna split this presentation into two parts. We're going to make sure that we have one presentation that's specifically about what the vaccine is, how it works, how we got it. And then we're going to talk about distribution, whether it's being done equitably, what are the challenges there, and some of the community concerns. So that's going to be kind of the two parts. And we have, as I said, folks that know what they're talking about that are going to tell us about it. But one more thing that I wanted to cover, because it's something that just happened in the last couple of days, and certainly just happened, this one happened today, as far as your Bronx site, on February 3rd. So just today, Governor Cuomo announced that in partnership with the city and the state, so the partnership with the state and the city, as well as the Yankee organization and Somos Community Care and the National Guard, Yankee Stadium has been made into a Bronx-only vaccination facility. Now, we're going to talk about this a little bit more later, but you should know that if you are a resident of the Bronx, this is available to you starting tomorrow. You see the information right there on your screen. You can either call 1-833-766-6769. That is 1-833-SOMOS-NY, or online at www.somosvaccinations.com. And I want to leave that up there for a little bit, because if you're a Bronx resident, I want you to write this down and make sure, by the way, you will have to bring, just so you know ahead of time, you'll have to bring proof of eligibility and residency. And that means that you can have your ID, which also includes the New York ID, by the way. You can actually have that, not just a driver's license, non-driver's license, but also that ID. The NYC ID. You can have a statement from your landlord. You can have a current rent receipt. You can have a mortgage record, something that proves that you are a resident of not only the state of New York, but of the Bronx, to make sure that you can get access at Yankee Stadium. And also, you can also you can show your school, your current mail, like mail that's mailed to you, and school records as well. But again, You can make sure to call my office if you have any questions about what are some of the documents that you need to have in there, and just make sure that you write down this number and this website so that you can get access if you are a Bronx resident. Um, so I wanted to make sure there's a lot of information that these folks have, and I want to get to them because it's important that we get the information again from trusted sources, and these folks are absolutely trustworthy. So I wanted to make sure that I introduce them to you, and then we're going to go right into it. And the first segment, as I said, is the COVID-19 vaccine, how it works, and who gets it, right? And we will have the first person that will kick this off is Dr. Sumir Sagal, who is the Chief Medical Officer for Essen Healthcare. He is the founder and the Chief Medical Officer of Essen, and he started with just a single South Bronx office in 1999 and currently has over 30 locations throughout the Bronx and is the largest private comprehensive multi-specialty medical group in the Bronx. And they have been great allies to our office over the last couple of years. And Dr. Segal definitely knows what he's talking about. So I'm going to pass it over to him. Dr. Segal, tell us a little bit about this vaccine. Why don't you?
Thank you, Senator Gustavo, and thank you everybody for joining this panel. It's a pleasure to be here. For almost a year, we have been under attack by a deadly virus causing COVID-19 disease. This virus spreads very early, very infectious, and affects the whole body, um, especially the lungs. Finally, we have a vaccine that can protect us from the symptomatic COVID-19 disease. And therefore, we all must have this vaccine. And I'm very happy to have some slides to show. And if you go to the next slide. So vaccination, I'm going to try to break this down so everybody can understand, because anything new causes concern. We all like to be educated, but ultimately we have the only protection from this disease, that is a vaccine. Every second of your life, you're attacked by microorganisms. These are microorganisms, may be bacteria or virus, want to enter your body, live off your body, and in return make you sick. And this sickness is called infectious disease, but it's called by infection. However, we are protected by our immune system. It works like the security personnel, and it is made up of special organs which make these cells and chemicals called antibodies. So as soon as this bacteria or virus enters the body, these antibodies go into the body and attack and kill these microorganisms. They are like Pac-Man, the video game. So they go and they eat up and kill them, like Pac-Man eating those food pellets. And that helps to protect our body. And this is what vaccination does. It helps to introduce these microorganisms, either killed or weakened. So it stimulates our immune system to produce these antibodies so that we are protected when this dangerous bacteria or virus enters our body. And vaccination is not new. Next slide. A vaccination actually is considered one of the greatest medical achievements of modern civilization. It has saved so many lives and allowed us civilization to flourish. Many vaccines are given in series of shots in the childhood and have nearly eradicated many diseases that used to kill a lot of people in the past. Polio, which ravaged the world back in 1940s, especially children. Parents were afraid of letting their children go out to play for the fear they'll get exposed to polio, very similar to what is happening with COVID. And Dr. Jonas Salk invented the vaccine, and the first dose was given in 1955. Today, we have no polio in this country. In fact, polio was eradicated by vaccination in 1979. This is how powerful vaccines are in fighting diseases and protecting us. And of course, there are many others like measles, mumps, rubella, diphtheria, bacterial influenza, whooping cough, chicken pox. Many of you have suffered as chicken pox in children, but back in 2011 and 12, most states have made it mandatory for children before they go to school to have chickenpox. So now they will be protected from the virus of varicella. Next slide. So uh, how does these vaccines work? So we need uh, our body to be stimulated for producing these antibodies. And platforms are a way of introducing this microorganism to stimulate the immune system to produce antibodies so they protect us. So there are different kind of vaccines through various platforms. We'll talk about the platform for COVID-19, but just to give an example, there are viruses that are killed and introduced into the body, like flu vaccine or polio vaccine, even rabies vaccine. There are pieces of virus that are taken and introduced, like for hepatitis B vaccine, shingles vaccine. Then there are virus-like particles, which now help to prevent cancer, cervical cancer in women, like human papilloma vaccine. And then there are also vaccines that are weakened, attenuated, we call them in medical term, which are injected into the body to produce protection through antibodies. They're called Ebola. And then finally, we have the RNA vaccine, which we'll talk about. That is what is used for COVID vaccination at this point. So if you go to the next slide. Uh, so the virus, COVID virus, it looks like that. It has multiple spikes on its surface, which are called spike proteins. And they make it look like a crown, and that's why it's called coronavirus. And ultimately, the effect of the vaccine is to produce antibodies. They stimulate the immune system to produce the antibody. And there are different ways to do this. You can take the protein that on the surface, clean it up, inject in the body. You can take it and the gene that makes the protein and inject into the body through adenovirus. Or you can take the messenger RNA that codes for the vaccine and inject in the body. And right now, currently in United States, we have two vaccines that are approved that are mRNA, Pfizer and Moderna. Next slide. And as we inject the vaccine, and these vaccines are given in the upper arm, left or right, depending upon your preference, they go into the body and they cause the body to produce spike proteins. And these spike proteins are harmless for us. However, the spike protein produce antibodies, which now are activated to kill COVID-19 virus as soon as it enters the body. So this is how these vaccines are able to protect us. And uh, this is probably the best protection we have at this point from symptomatic disease COVID-19. Next slide. So who all can have this vaccine? And I'll go into a little more details about this vaccine, the kinds of vaccine we have in a few minutes. But it's very important that we know who can get the vaccine. Almost everybody can get the vaccine, with a few exceptions, which I'll touch base. And it's important to know that before you get the vaccine, you have to fill a screening questionnaire. The screening questionnaire is to basically to get information so we can monitor the control of the disease through vaccination as you're vaccinating. So the government, which is giving, who has bought these vaccine and then is giving it free for vaccination, is able to see how are we affecting this pandemic through vaccination. So when I say well, almost everybody can have it, well, anybody over 16 to 18 years of age can have this vaccine. Even people who have weakened immune response like HIV can get the vaccine. There are people who have allergies, can be allergic to seasonal allergies, gloves, pets, insect bites. Uh, they all can get the vaccine. A history of allergy to some medication, oral or injectable, you can get the vaccine. If you had non-serious side effects to getting a vaccine in the past, you can have the vaccine. If somebody has family history of allergic reaction to something that is not related to a vaccine, or an injection, you can get the vaccine. The only difference is that instead of 15 minutes of observation that we typically recommend after the vaccine, we want you to be observed for 30 minutes. Having said that, the recommendation that I'm giving, a general recommendation, if you have a specific condition or a question, you should consult your primary care provider. There are certain cases where we like to have caution to vaccinate. For example, if you have fever, an acute illness, we want to review it, do a risk assessment, and see if we need to defer it or we can give it to you still. If somebody has allergic reaction, severe allergic reaction to any vaccine other than the COVID vaccine, or if they had allergic reaction to an injection in the past, severe allergic reaction, yes, you need to have a risk assessment done through your primary care provider and then decide whether you should get the vaccine or defer it. There are some people, in some cases, that should not get this vaccine. Those people who had severe allergic reaction to some of the component of the Moderna or Pfizer vaccine, specifically polyethylene glycol, should not get this vaccine. And there are documentation, millions of vaccines have been given, and very few people qualify for this. You can go to the next slide. There are also some exclusion criteria where we don't want to give the vaccine at this point, and we may like to defer it, like somebody having high-grade fever, or if somebody has COVID-19 disease. Until they recover, we recommend they should not get the vaccine. If somebody got monoclonal antibody treatment within 90 days due to COVID disease, you should also defer it and then reevaluate it after you recover. If you got a vaccine, any kind of vaccine, 14 days before, there should be a 14 days interval between another vaccine and the COVID-19 vaccination. So these are the things we need to keep in mind, and they are simple criteria, and that is part of the screening questionnaire. Next slide. So let's talk about the vaccine. Currently, there are two vaccines that are approved, both messenger RNA vaccine. Both are given in 2 doses. Pfizer is given 3 weeks apart. Moderna is given 4 weeks apart. Although there is still some discussion as to whether there can be longer interval period. Both these vaccines are effective across all genders and races. And after the second dose, 95% effective. But there are some difference between the two vaccines. Pfizer requires ultra cold storage. So it's stored at minus 94 degrees. And it can be given to anybody 16 years and up. Moderna, on the other hand, can be frozen in regular freezer, -4, refrigerated for a month in a regular refrigerator, and is given only for people 18 years and up. There are special refrigerators for Pfizer vaccine. So most commonly, we are seeing Moderna being used in the community. Next slide. So what happens after you get the vaccines? All the things that you are worried about. Well, the most common side effect of these vaccines is pain at the injection site. If anybody got an injection before, a flu shot or a vaccine before, you know it hurts for a day or two. And that's the most common side effect. Some people get a little fever, headache, some tiredness, some pain, but that usually goes away in a day or two. The severe side effects are very rare and temporary. Some people have reported a few more side effects after second dose of Moderna, like more pain or little chills, second dose. I got my 2 doses of Pfizer, and other than little fever chills, I really didn't get much side effect. And it was very temporary, and a Tylenol took care of it. Next slide. There are 2 more vaccines that are coming to the market. Johnson & Johnson vaccine, which is in stage 3 trial with 45,000 participants. It is using the adenovirus as a platform. It is single dose. There is no freezing required. So it can be stored in a refrigerator up to 3 months. And it is about 66% effective against moderate to severe disease. Another vaccine, Novavax, in small early trial, it is using purified spike protein that induces immunity, again, one shot, but it's still very early. Everybody's hoping that we'll get Johnson and Johnson in the next few months, and that will be another alternative for a lot of people. Next slide. So once you get the vaccine, do you still need to wear a mask? How does your life change? Well, as I discussed and everybody knows, 95% effectiveness means that you're very protected against COVID-19. However, our body harbors microorganisms. These microorganisms may not enter our body or our blood and cause infection, but they are on our skin, they are in our noses. So that's why when we sneeze into an elbow or a tissue, so we don't spread our germs to everybody else. Similarly, we may still have COVID-19 exposure and we are protected from the virus, but unless we take precaution, we can spread it to people around us. So you must wear a mask and take all precautions you're currently taking after you get the vaccine to protect people around you. Next slide. So let's talk about some myths and facts about the vaccine. Myth: they aren't safe because they were created so fast. Well, they are very safe. Non-clinical, clinical, manufacturing information for both the vaccines have been reviewed by Data Safety Monitoring, ACIP, CDC, FDA before emergency approval. So they are safe and millions of doses have been given. They can cause people to have serious side effects like Bell palsy. Pure myth. Serious side effects from both Pfizer and Moderna vaccine in the clinical trials are very rare. And other than the rare reports you see in the newspaper, on the news media, after millions of doses, very few rare side effects have been reported. Myth: they make people sick. No. The reported side effect from the vaccine is injection at the site of injection, pain at the injection, at the site of the injection. That goes away in 24 to 48 hours. The vaccine do not contain live virus, so they cannot cause the COVID-19 disease. These are important things to remember because there's a lot of concern, fake news out there, and it's important to discuss with your primary care provider and with people you trust. Next slide. So these are some of the helpful hints. Uh, there's a lot of people asking, am I eligible? Well, you can go to the New York State website and look if you're eligible. In the same website, you can also look at who is qualified under phase 1A and 1B, where we are currently. There's a CDC website with COVID-19 vaccination information, very useful, very informative. And after you get the vaccine, you can also enroll in VSafe, which is a health check-in with CDC for any side effects or any information you need after you get the vaccine.
There you
Next
go.
slide.
One of the things that I wanted to do, doctor. So I wanted to just leave that last this one right here. I'm going to leave it up for a little bit because I'm actually want to make sure that we move on to Dr. Zingman.
Sure.
But I want you to remain with us because I know that if I can, I'm going to leave this on the screen, and we're just going to leave your face on the screen there because I want people to that very friendly, knowledgeable face. I want you to connect it to vaccinefinder.nyc.gov. That is the type of friendly face that you will see at the place that will, this website will help you find a place to get actually vaccinated. So thank you, Dr. Segal. Remain with us because I'm sure that we will have questions. There's a couple of things. There's a couple of things as we go on to Dr. Zingman that I want to make sure that we underline. And as Doctor said, I mean, there's a lot of information there. I know there's a lot of information there. By the way, someone was asking in the chat about whether this will whether this will be available in the future, and it will be. Right now, it is on Facebook Live, and it will remain as a video there as long as Facebook exists. It will be there, so you can actually refer it to folks who might want to see it in the future. But there's a lot of data that you saw there, a lot of information that you saw there about the fact that vaccines are safe. They are necessary for the point of the disease that we're in, and it is something that's going to be made available to folks. And we're going to talk about some of the challenges in getting it to the right people. But I wanted to the next person that's going to be with us is somebody else who is also incredibly knowledgeable. And that is Dr. Barry Zingman from the Montefiore Medical Center. And he's the clinical director of infectious diseases at the Moses Division of the Montefiore Medical Center, and also the medical director of the Montefiore AIDS Center. And just so that you know that we're very, very glad, we're very blessed to have him today. In 2020, responding to the COVID-19 pandemic, he was the principal investigator at Montefiore Einstein on the landmark study that demonstrated the effectiveness of antiviral drug remdesivir. I hope that I got that right, doctor. For people hospitalized with severe COVID-19, and he is currently leading the vaccine trial for AstraZeneca University of Oxford vaccine trial at Monty. So doctor, thank you for being with us. So give us your perspective on this, and then I want to bring both of you up to ask a couple of questions about the vaccine itself before we move on to the community concerns. But doctor, go ahead, sir.
Great, thank you. Thank you, Senator Rivera. Thank you, Dr. Segal, and the rest of the panelists for being on this panel tonight. And thank you, everybody who's attending for this really important topic. Why don't I go to the first slide, please? Okay, so I'm going to be talking a little bit of overlap with Dr. Segal, but also some differences. Some of the overlap will be to emphasize some of his points. So next slide, please. Okay, so let's just make sure that everybody is on the same page in terms of the language. So SARS-CoV-2 is the virus. It stands for Severe Acute Respiratory Syndrome Coronavirus 2. So SARS-CoV-2 is the virus. COVID-19 is the illness caused by the virus. So I just wanted to set that out there just to make sure, because we do sometimes go back and forth between the two terms, SARS-CoV-2 or COVID-19. Next slide, please. So Dr. Segal gave a wonderful overview of the vaccination effort around COVID-19. We are looking at vaccinating everybody because they benefit you, the individual, by preventing infection, preventing COVID-19 disease, and reducing the severity of the disease. These were hoped for outcomes a few months ago, and they are what we are seeing. So with all the vaccines that have been approved so far, we are seeing all of these benefits to individuals. We have not yet seen the community benefits because not enough people have been vaccinated yet, but this is what we are looking for. So we are hoping that we'll be able to vaccinate the community and reduce transmission, improve the health of the community, and eventually get out from under all the restrictions that we have. Next slide. So Dr. Segal mentioned this. How does a vaccine work? It is by teaching the body to recognize invading microorganisms, germs, so that the body can now recognize the germ before it takes a hold in your body and causes serious problems and death. The body responds to it, produces these cells and proteins called antibodies, and then the virus is blocked before it can do more damage. Next. Now, the vaccines that are out now and that will be out soon, as Dr. Segal mentioned, all have only portions of the SARS coronavirus 2. They have little portions of it so that your body gets exposed to these little portions, your body reacts to them, and then can fight off the whole virus when it sees it. And just to make this point clearer, that you cannot get COVID from the vaccine. If you gave somebody a wheel, handlebars, and a chain, that doesn't mean you've given them the bicycle. And it's the same way with the SARS coronavirus too. We are giving through the vaccine a little portion so that your body reacts to it and is ready. And that's shown in the bottom line as well. Next slide. And what are the vaccines like this? So many that you have already gotten, so many that your friends, your family have already gotten and have been safe and effective. Many of them are listed here. Next slide. And as mentioned, the idea is to block the spike protein on the surface of the virus from binding to a human cell. Next slide. And so we give a vaccine first to produce antibodies, which you can see in pink and green would be blocking that spike protein so that it could not get into the cell and reproduce itself and cause the damage. And this is what we're seeing with these vaccines. Next. So how do you develop a vaccine? How do you test it? And of course, how do we develop this so quickly? So first, you have to have the idea to develop a vaccine. You have to have the need to develop the vaccine. You have to have ideas of how to try to develop a vaccine for it. You do research up on it. You then, when you get promising ideas and promising candidates for the vaccine, you test them in animals first. Then you test them in human studies in progressive phases. Next. And these phases are called phase 1, which is the smaller trials right at the very start, small numbers of people, early trials. Sometimes we're just trying to figure out the right dose that might work and be safe. Then we move into phase 2 trials. Those generally take longer. They're larger. We look more carefully at the outcomes and at the safety. And then we go into the very large phase 3 trials, which is the final trials before approval. In which we're really going to figure out who it works for and how safe it is in large populations. Now, there's a misunderstanding about this with COVID. People think that this has been rushed. This is not the case. All of these things just were able to happen much faster because of of how quickly we developed the knowledge about SARS-CoV-2, about the virus itself. They determined its amino acids, its nucleoside, its genetic code in the first month after it was discovered. This would have taken years in the past. So in the first month, we knew the genetic code. In the month after that, we knew about the spike protein. We actually already knew about spike protein, but we identified the spike protein here. Then phase 1 studies of the vaccine started early in March, April. And instead of us taking years to go through the different phases, with tremendous support from the US government, Britain, and many other countries, all of these phases were able to be simply done faster. Normally in the old days, we would have a phase 1 trial. The company would be barely putting together the money to do the trial. There wouldn't be a lot of motivated people necessarily to be in them. You'd take time to analyze the data. You'd go to the FDA. They would take a few months to review it. You go into phase 2. It takes a while, but everybody was intensely focused on getting these things done with no delays. So, for example, let me just mention the remdesivir study that we did in March at Montefiore. I learned about that NIH study on a Sunday, and we were giving out the medicine 8 days later. That was a process that normally would take 6 months. But with COVID, we were able to do it in 8 days. So this is what happened. We've just simply not put up with any delays in this whole process. And And how did we have the vaccine so fast even after the studies? It's because governments started supporting production of the vaccines even before they knew if they were going to work, so that if they were shown to work, the millions of doses would be ready right away. So this has never happened before in the history of medicine. So this is why we should be thankful, not suspicious of this process. Next slide. And so all of these trials, the FDA has set the rules for studying the vaccines. Every trial needs to meet the same high standards and has met the same high standards. Large numbers of people, at least 30,000, are in each trial, diverse populations of those at risk. Each study has to be what's called double-blinded and placebo-controlled, which means that people don't know which they got, whether or not they got the active vaccine or a salt solution. And that is to give us the most reliable results that'll come out of that trial. So we know truly, does the vaccine work and are there side effects? So this is the best way to study any medicine, and it was done for vaccines. People are being studied very closely, followed very, very carefully for safety and efficacy. It's being analyzed rapidly. And the goals that the FDA set was that it would be at least a 50% drop in COVID from any successful vaccine. And as Dr. Segal mentioned, we're seeing even upwards of 95% success in blocking COVID. And the studies are going to be going on for years to come to look at long-term outcomes, to look at whether or not people, for example, need boosters, what does the immunity wear off, but we'll get there when we get there. Next slide. And so there have been 7 major vaccines studied in the United States. The first 2 on the left, Pfizer and Moderna, are the ones that have been approved so far. The AstraZeneca vaccine we are currently doing at Montefiore. The Janssen vaccine just actually applied to the FDA for approval today. I just got that right before this panel. And AstraZeneca should be applying for FDA approval in the next 2 or 3 weeks. So we are very likely to have 2 more vaccines sometime in the next month or 2. Now there are 3 vaccines on the far right: Merck, Sanofi, and Novavax. Dr. Segal mentioned that Novavax is in advanced trials, but Merck and Sanofi vaccines, they have failed. They were shown to not be effective enough, and they are not being developed further. And this shows us that the system works, that vaccines that are working well and are safe and effective are moving forward, and ones that are not are stopping. Nobody's letting these through if they don't meet the standards. Next. And not only that, but agencies around the United States have rolled out the most extensive safety monitoring of any vaccine ever for the COVID vaccines. For example, there's a text messaging system called vSafe, in which people can voluntarily enroll in which they get prompted by text messages daily for the first week after their vaccine, and weekly through 6 weeks, and then intermittently afterwards, to be able to monitor side effects in large numbers of people. Next. And what you can see here, that as of the date of this slide, over 21 million people had gotten the 2 vaccines already. Over 2 million people had already registered in vSafe at least once about whether or not they were having any side effects or not. So we actually have side effect information on 2 million people. And it included 15,000 people who were pregnant and got the vaccine. Next. And so as mentioned before, far and away the most common side effects of the vaccine are local reactions to the shot itself and fever, chills, muscle aches, joint pains. And these are quite common. With both vaccines, Pfizer and Moderna, the side effects are common. If we compare, I put some stars at the bottom, the blue stars, you can see that shows the first dose of Pfizer and the first dose of Moderna. What you can see is that the side effect rate is about the same between the two, approximately the same. We don't have the fullest data on Moderna's second dose because it came out later. But you can see that for Pfizer, the second dose, side effects are significantly higher after the second dose. So there is a higher rate of these side effects after the second dose. That has been seen with the Moderna vaccine too. Now these last a day or two, sometimes three, but they are tolerable side effects. Next. And why is this so important? And why should we be not skeptical about these results? And the reason is because of the history of vaccines. It bears emphasizing that historically, more than 90% of all side effects of vaccines have been in the first week after getting it. At least 99% of all side effects ever from a vaccine have been in the first month. So we are monitoring for long-term side effects, absolutely, but there is little expectation that any will be seen. Side effects almost always happen early, and people have been asking if it affects fertility. It doesn't. People have been asking if it causes COVID, if it gives you COVID, if it makes your test positive. It doesn't. But it does give you, it may give you a positive antibody test, because that's what the vaccine is for. It's to give you antibodies, right? So there's an antibody test that might be positive. Next. And then there's a huge, very robust study going on at multiple large health systems around the country called the Vaccine Safety Data Link, that not only is looking at the side effects of vaccines in these large populations, but it's also comparing these events to people who haven't gotten the vaccine, to matched people who never got the vaccine, to see whether or not some things are actually caused by the vaccine or not. So next slide. And in this way, this is how we're going to be really looking at in millions of people some of these really rare and unusual side effects that you may have heard about, like Bell's palsy, which is a very uncommon thing. Now, what this study has already shown is that of all of these various different possibilities, actually none of them have been occurring more commonly in people who've gotten the vaccine than in people who didn't get the vaccine, because things like this happen, unfortunately, to us anyway. And so that's why it's very, very important to have a comparison group that didn't get the vaccine, and that's what this study is showing. And this is an ongoing study of some side effects that have been in the news a lot, but actually aren't really occurring much. Next slide. So who's received the vaccine? 27 million US residents as of today, 3.2 million New York residents, 1.3 million people each day in the United States. And this is one of the things that I just say to people: there's no reason why you can't be one of those 1.3 million. And
Doctor, this is where we're going to actually dig deeper into this now.
Great.
Yes, there are. Now, first of all, you have received it.
Yeah. So actually, my wife, my daughter, and my son got it before me, and then I got it when Montefiore offered it to me.
So you have all of these. Thank you so much, Dr. Zingman. You obviously have so much across the world, so much across the country. We've had a lot of them. One thing that I wanted to talk about here as we transition to the community concerns. And we can actually get rid of the slideshow now, by the way. So one of the things I wanted to, as I transition into community concerns, is that as much as 27 million people have gotten it, and as Doctor said, 1.3 million folks are getting it on a daily basis, but there is still issues with supply. Now, obviously, we are 2.5 weeks, maybe 3 weeks in to the Biden administration. That is a wonderful thing. Because regardless of how you feel about regardless of how you feel about one party or another, we have somebody who actually is bringing the resources of the federal government to be able to address this issue that is so incredibly important to address, because it is a national problem. It is not just an issue in New York. It is not just an issue in Florida, in Mississippi. It is a national issue, requires national resources. But even as 27 million people and 1.3 million people are getting it, we still want to make sure that it gets to the right places. And so we're going to transition to the second part of this. And I want to make sure that people, as there's going to be questions, and as you get questions, drop them in the chat. I know that there's a couple that are already in there. We're keeping track of them. So make sure that you drop your questions in the chat. The technical part of this is the technical part of this is behind us. But we still have the experts on deck, but we have other types of experts now that can talk to us about the community concerns. And we're going to start it off by introducing Betsy Morales Reed from the Hispanic Federation, who is the Senior Director for Health Initiatives at the Hispanic Federation. And she also leads the Latinos Unidos contra el SIDA, or LUCES Advocacy Coalition, while also developing healthy living programs and health advocacy strategies that engage communities and their leaders. Madam, take it away.
Hello, everyone. Good evening. Thank you, Senator. Thank you so much, everyone, for joining this important conversation. I'm going to wait for some slides to pull up. Next slide. So I'm going to talk a little bit about, like Senator Rivera just mentioned, the disparities and some of the things that we're seeing in the community. And one thing that I wanted to discuss is that this quote here is, Blacks and Hispanics have higher rates of COVID and have had higher rates of COVID and hospitalizations and mortality than when you compare it to their white counterparts. And this disproportionate impact mirrors inequalities in socioeconomic circumstances that leave people of color at higher risk. Next slide. And this impact of health disparities, we can see it through these different things that, well, for example, I'll start with the first one, higher rates of pre-existing conditions. So we have more hypertension, more diabetes, more obesity, more chronic kidney disease, and all of these are conditions that worsen our outcomes. We also have a higher risk of social exposure, and that's because it's harder to social distance. We live in tighter living spaces with more people. We also form a large part of the essential workforce, and we've been working through the pandemic at a higher risk for infection. And also we have a reduced access to healthcare. So many Black and brown folks don't have health insurance. And that means that they don't get to go to the doctor and they don't have their regular checkups when they can detect illnesses in advance. And these illnesses, which ultimately with this pandemic can be more than serious. It can be a serious health challenge, but it can become deadly. Next slide. And we've now seen that these disparities have also gone towards vaccines and actually getting the vaccines. The city just put out data that Black and Latino New Yorkers are far less likely to have gotten the coronavirus vaccine than white residents. And actually, even more than that, a significant share of the vaccines given in the city have gone to non-residents, and most of those being white folks. So we already are seeing the disparities in terms of vaccination. However, it's not just access. So access is a huge issue, and my colleague Lorraine is going to discuss that in a couple minutes. But another big issue is hesitancy. So, the trust in the health system right now appears to be at an all-time low. And, we think about this history of racism, discrimination, and unethical medical practices, and that these communities have faced. And now this makes them much less likely to want to get vaccinated. Next slide. But I do want to highlight the importance of the vaccines. As Dr. Segal mentioned earlier, vaccines have eradicated major and life-threatening diseases such as smallpox, polio. We've been able to control serious infections like measles, mumps, rubella, tetanus, and so much more. And vaccines they basically have been one of the greatest contributions to public health in this time, in our modern era. But for COVID-19 specifically, this vaccine right now, it holds the best hope for getting our lives and our economy back to normal. You know, the COVID vaccines, they have been proven to be effective. They're highly effective at preventing COVID-19. And it's one of the many important tools that we have right now to help stop the pandemic. Next slide. And I want to talk to you a little bit about what are the thoughts in the community and what's going on. So we know that some folks are, they are willing to get it. And actually I believe it's about half of the general population says that they're willing to get it as soon as it becomes available. So that's a good thing. We have some folks that do not feel like they want to get it. And we also have some folks that are saying, well, maybe I'll just wait till more people get it and see what happens. So I want to talk a little bit about that hesitancy. Next slide. We have folks that are saying, well, I don't know if the vaccine is really effective. Is it going to work? But creating a vaccine is a very complex and highly regulated process. We saw this in some of the slides that we've seen already. Given the world impact of the pandemic, significant resources have been devoted both by the federal government and the vaccine manufacturers to create the vaccines to prevent COVID-19. And clinical trials have found them to be about 50% effective after the first dose and 95% after the second dose. And that's pretty good. Some other vaccines may be at 75% or for other diseases, and they work. So this being 95% effective, what we have now, it's amazing. Studies have also shown that COVID vaccines are effective at keeping you from getting COVID-19, but also it can prevent you from getting a serious illness due to COVID-19. Next slide. And this is another thing that folks are worried about is the safety. So before any vaccines receive any authorization or approval, they go through the process with the FDA, the Federal Drug.
Betsy, I'm sorry, if you could slow down a little bit to make sure that the translators, that the folks who are doing interpretation can keep up with you. Thank you.
I will. So I'll slow down. So yeah, the vaccines, and the system in the US for approving this is a long process. And the vaccines are being held at the same standards that other routine vaccines are. And several experts and independent groups, they evaluate the safety of the vaccines being given to people in the United States. So vaccines are continuously monitored. And I think it was Dr. Segal also mentioned vSafe, which is basically a smartphone-based program after vaccination health checker, where you would get reminders about your next dose. You would be able to report any adverse side effects or other events that happen because of the vaccine. So this is a one way that it's being monitored. There's also the vaccine adverse event reporting system, and this system also collects information from healthcare professionals, from vaccine manufacturers, from the public, and this will also help us monitor and see. And as of right now, you've seen the data that Dr. Zingman just presented about these side effects that, again, really the most common side effect is pain at the site of injection, right? So next slide. The other thing that folks are worried about is the speed. And I won't go into this a lot because Dr. Zingman just mentioned it, but the protocols, again, no protocols and requirements were bypassed, right? Experts worked around the clock. These folks were really, working through a transparent process, trying to get this vaccine approved in a safe and effective way. Next slide. So just, again, the vaccine is important and it's necessary. The COVID-19 can cause serious illnesses or even death, and there is no way to know how it will affect you. And if you get sick, you can then spread it to your friends or family or others around you that you don't know how they would react to COVID-19. So all the vaccines that are currently available have been shown to be highly effective at preventing it, or at least that you would at preventing at getting a serious illness. So I want to touch, before I end, I want to talk about some of the myths that are around and the misconceptions to just clear some of that stuff up. And again, Dr. Zingman and Dr. Zagal also mentioned some of these things, but some folks think, oh, will the vaccine give me COVID? Again, no, the vaccine will not give you COVID. You're not getting the virus itself. The other thing that people are saying, well, COVID is I want to travel, and then if I take the test, I'm gonna come up positive. So again, I think Dr. Zingman also mentioned the vaccine will not cause you to test positive for the viral test. However, you may have show that you have the antibodies, which is a good thing. People are asking, is it safe to get the vaccine if I have an underlying medical condition? Yes, COVID vaccination is especially important for people with underlying medical conditions like heart disease, lung disease, diabetes, etc. People with these concerns are more likely to get sick from COVID-19. So these folks are definitely top of people that should be getting the vaccine. Folks are also asking, oh, well, should I get vaccinated if I already had COVID vaccine? Yes, you should get vaccinated because you can get COVID, you can become infected more than once. And we're not sure how long our immunity lasts after you've had COVID. So very important to get vaccinated. And again, I'm not going to go into the side effects because it was mentioned already. But one thing that we keep hearing in the community is about it changing your DNA. So the vaccine does not change your DNA. Dr. Zingman mentioned it's RNA. It's pieces of laboratory made material that will not change your DNA. It's not going into the nucleus where you would have to change the DNA. So no, it will not change your DNA. Next slide. One last important thing that we should really be concerned or pay attention to is predatory activities. So unfortunately, there have been scammers calling folks up and saying, hey, for a fee or a small deposit, I can put you at the top of the list. I can put you on a reservation list for you to get the vaccine. This is not true. So do not share bank information, social security card information, or anything like that, because it's not true. A social security number is not required to get the vaccine. So for folks that may not have a social security number, you're eligible to get the vaccine when your group is up. And there is no cost for vaccination in New York or in the country. The federal government has given the vaccination free for everyone. If you have health insurance, Medicaid, Medicare, there may be like an administration fee for them, but you would have no copay and you would not be billed because the vaccine is given to you at no cost. So just one last thing, next slide. The things that you can do is basically, right now it's unclear, which groups are going to be next, but we're working hard to get the vaccine out there for everyone and get more doses so that we can give it to everybody. Just make sure that you get vaccinated when it's offered to you. It's very important you do that you participate in VSafe, the tool that we mentioned to help the CDC monitor for health effects or adverse events. Make sure you share experiences with your coworkers, your friends, your family, the basics and be able to answer questions appropriately and correctly. And of course, if you've gotten the vaccine or when you get it, make sure you wear that button nice, loud and proud so that everybody knows that you did it. Thank you so much.
Thank you so much, Betsy. And there's a couple of things there that I want to make sure again to underline. Again, as we said, there's certainly a lot of rumors and things flying around, but the folks that have spoken already, these are folks who do this for a living. This is a safe vaccine. It was developed in the right way. It was done very quickly because it needed to be done very quickly. A lot of resources were put into this, and it is something that is going to make it so that we can get back to some level of normalcy. And we need to make sure that we get it in communities of color. But it is true that there are concerns that exist, like serious concerns that have to do with real issues that have existed in the history of our country as it relates to historical mistrust as it has to do with medicine. And there's also a frustration as far as access issues. And I wanted to make sure that we had an opportunity to hear from someone who obviously thinks about this consistently and has been a leader in talking about health equity and inequity. And that is Lorraine Braithwaite Hart, who is the NAACP New York State Conference Health Chairwoman, holds a BS in Science and Health Science from Brooklyn College, a Master in Science and Community Health from Long Island University, and has worked as an instructional support specialist at SUNY Downstate Medical Center, and is a licensed as a New York State clinical technologist, earned qualification in immunohistochemistry. I hope I got that right, from the American Society of Clinical Pathologists. So not only somebody who, again, has the professional experience, but who has thought deeply about issues of equity and access to healthcare. So, Ms. Braithwaite, please go ahead.
Good evening, everyone, and thank you for having me here. As a social justice person from the NAACP, our role is to highlight how disparities are affecting Black and Brown communities. And so COVID-19 is an equal opportunity infector. It doesn't matter your race, ethnicity, it doesn't matter. And in this case, though, it has affected more Black and Brown people simply because of where the congregation I'll speak about New York City, where we are congested, where we are living most. So if you have more highly populated areas, the disease has a propensity to spread easier. So that being the case, you then have the issue of pre-existing conditions that are highest for Black and Brown people in these same communities. And so we look to see what is happening. Social determinants of health have created the disparities that exist today. Our Black and Brown people have been subjected to medical malpractice, malfeasance over the years. If I look at what has weighed us down as a community, we stay focused on the syphilis experiment. It was an experiment where the disease was injected into people. They were paid, they were not told really what was going to happen to them. And then, although penicillin was created and invented within the same time period of which this experiment was occurring, and it could have cured people, the experimenters chose not to give them a cure. So they just let it run. And so we know that we were used. Today, the difference with COVID-19 is that it is a preventative measure. It is not an experiment to us. We are all in this together. So when the vaccine is available, now that it is available, we are still, psychologically feeling, hey, this is an experiment. But if a vaccine is available to white, Black, and all in our society the same way, throughout the world is going to be used the same way, then we have to start rethinking. You cannot take away people's feelings. You have to start rethinking, maybe if I can prevent myself from ever getting this disease with this vaccine, I should give it a thought. And we are finding that more and more educating the population, Black and Brown people, the message is getting through. We are not guinea pigs, but we want to educate so that people understand why the vaccine is so important, okay? Looking at 65 years and older, that's a population that now, in the past, perhaps may not have been on board because they have lived the syphilis study and all of the other egregious medical malpractices that have occurred over time. They are buying into more getting the vaccine than the younger population that has the right to get the vaccine, like nurses and frontline workers, because they are seeing their very own counterparts dying a death that is so egregious. So therefore, they want the vaccine now. What we have to make available is access to care for them that is easy. They should be able to, and it is happening. I can tell you that it's happening in Brooklyn, okay? But before I deal with Brooklyn, you mentioned Yankee Stadium. There's over 1,000, I understand, appointments and vaccines available. But I'm glad that you brought it up, because these are vaccines that are going to be available next week to the community. And that information needs to be gotten out more. So now is an opportunity, and this is what needs to be happening in our communities at the ground level, within the pockets of small community hospitals. I can tell you what is happening in Central Brooklyn through the One Brooklyn Health Consortium. That consists of Interfaith Hospital, Kingsbrook Jewish, and Brookdale Hospital. They have gotten a system that is working excellently. They have partnered with community-based organizations, with the police precincts, the churches, and they call them when they know that they're going to get a batch of vaccines. They tell them, listen, can you guarantee me 40 senior citizens that can come from your services or your center, or that you can contact, to come in on Wednesday between these hours? And they have gotten those numbers. So not only do they guarantee having a certain amount of patients coming in, but they also open it up to the community, and they tell the community within these hours, we are going to be administering the vaccine. And everybody that gets the first dosage also gets the second dosage. Some very important points that they have done. They have, and I call it the linkage of care. They use the electronic medical system records, and they go through their entire system to see the 65 and over and patients that they have dealt with in the past. Maybe they're not actively now, but they are the patients that were in the system. And they call them up and they tell them, we have vaccines. Will you be willing to come in? If we make arrangements, whatever ways that they can get you, can you get a family member, whatever. And that's how they're getting the people vaccinated. And the numbers are pretty high. So we need to ensure that the 65 and over have access. That doesn't mean that they have to get on a phone. Somebody needs to reach out to them, because many of them don't know how to handle the system of computers. And for those that come, when first they announced it, that the vaccines were available, we had people coming out from Westchester, from all over the place, and the people that needed the vaccine who did not understand and didn't know how to get to wherever the vaccines were, they did not access the vaccine. It's not that they didn't want it. In some case, they didn't want it because I just said the apprehension was there and they didn't have the education. But in other cases, they didn't even know that it was available. So we have to delete the problem of access. Access to care is important, and there's so many ways that it can be done. They even, the interfaith, the One Brooklyn even uses health coaches to make those phone calls. Those phone calls are important. And after a patient gets that first vaccine, they are then followed and called again and reminded it's time for you to come in for your second dosage.
Yep. And Ms. Braithwaite, so so we want to actually, and on that point, because you're describing some of the stuff that's happening in Brooklyn, we want to transition to talking about the stuff that's happening in the Bronx from a local provider. But then we're going to but right after that, we're going to get Q&A. But I want to make sure that you remain with us, but it is what you're talking about is incredibly important because it is a reality that when people are educated about this, when they get their questions asked, when their concerns are treated respectfully, they kind of most of the time change their mind. But if
Yes.
we don't make sure that we give them access to it,
Mhm.
then we don't, then it doesn't matter. It's like right now when we're talking about this, it is mostly not about hesitancy necessarily in communities of color. It's about lack of access in
Exactly.
communities of color, which is why we need to make sure that we focus our resources there. So you would agree with me that that's kind of how we need to focus on this.
This is exactly the direction. That's why I mentioned all of the different systems, the ways that this can be accomplished, reaching into the community and letting them know the vaccine is ready, but not just, hey, come to it's available here. How are you going to get those people there is the catch. And you have to set up a means by which they can get there. Make it easily accessible, have the buses, pick the people up, have the church, get the congregation, okay, this is when it's going to be available. We're going to make it available so that you can have a ride to the center, to the hospital, wherever it's being given. And for that, and I'll say that the NAACP has been in the forefront of getting this done. We are part of the governor's vaccine task force. Hazel and Dukes is our president, and she has done robocalls calling people to tell them that the vaccine was available at Harlem Hospital last week and when to come and all of that. So we are actively involved. And also we joined Let's Get Immunized for that reason as a steering committee, because if you're not part of the solution, you're part of the problem.
Correct. Thank you so much, Ms. Braithwaite Hart. And so we are going to transition now to talk about from a local provider, and we're getting to the questions. We have a lot of them stacked up, but we want to hear specifically from a local provider, and that is we're going to hear from Dr. Jay An, who is the Chief Medical Officer at Union Community Health Center. And that is a federally qualified health center right in the middle of my district. It's actually around the corner from my office. It's literally down the street, just a block away. But Dr. An received her BA from Barnard College and Columbia University and completed her medical school training at New York College of Osteopathic Medicine and completed her family medicine training at St. Barnabas Hospital and worked in its emergency department. That is right in the middle, in the heart of my district as well. So Dr. An, talk to us a little bit, and then after that, we're going to get to a lot of the questions that we have, by the way. But talk to us about the overview of the Union Community Health Center's vaccine distribution effort, and the from your perspective as a provider right here in the community on these community concerns, as well as the lessons that you've learned so far.
Yeah. So thanks everybody for inviting me. It's a pleasure to be here. One thing is we have to dispel the fears about the vaccine safety with more things like this, where you talk to them about truthful how the vaccine was developed and how safe it is, that there was no shortchanging of safety. It was an accelerated development, but it's safe. You dispel the fear with truth and education, as Ms. Braithwaite noted, as well as Ms. Morales, and also the access. You need access, and Union, as a federally qualified health center, we are in an underserved area, and we provide comprehensive care, including vaccinations. And right now we are partnering actually with our community-based organizations to bring people into Union, make it as convenient as possible to get vaccinated. So we're working with the city to work with people that live in congregate settings that can't come easily. So we're providing like coordinating transportation, as well as trying to get them vaccinated as easily as possible. And that actually has been very successful. We've been vaccinating for the last 6 weeks with the Moderna vaccine. There is some logistical concerns because it's a multi-dose vial, which is 10 doses in a vial. Once you open that vial, it's only stable for 6 hours. So we have to vaccinate those 10 people all together. So we schedule everybody in groups of 10. We do guarantee everybody the second dose we keep that second dose aside so we don't, we don't have people not completely vaccinated. So they're very happy with that. When they come here, we make it as easy as possible. We have greeters that find, as soon as you walk into Union, they meet the greeter, they're screened for COVID-19 as usual for all our visitors. And when you tell them that I'm here for vaccine, the greeter actually will get a coordinator and will walk them to the vaccination area and we'll walk them through the whole process. They're already pre-registered, all of their vaccine like form requirements, because New York State has a form that you have to fill out. We help them actually fill out that form. So it's very easy for them to do it, to get vaccinated. So we want it as easy as possible. Like I said, it's you want it not difficult. I think a lot of times people are hesitant because one, they're afraid of getting the vaccine because they don't know about the vaccine. But thank you, Dr. Segal and Dr. Thingman for really describing how the vaccine was developed and how safe it is, which I think a lot of people don't understand. And you really, that's what really kind of squashes the fear, is that, with really truth. So, and there is a lot of misinformation out there. So I think something like this, a forum, is very helpful for people that are scared to get the vaccine. And a lot of people that also they're fearful about the side effects because they think, oh, I'm going to get sick. And they don't realize if you tell them, look, that's your immune system gearing up, revving up. You're not getting sick with COVID-19. It's your immune system saying, hey, you know what? I have this protein, I'm going to make antibodies. And it's very short-lived. All the vaccines, so far, Union, it's a small microcosm of what's going on in the US. We've been vaccinating for 6 weeks. We have not had like bad reactions at all, besides what everybody already knows, which is the common side effects of pain on the arm and maybe some like achiness and sometimes joint pain and such, fatigue, headache, and possibly a low-grade fever, especially after the second dose. But everybody really tolerates the vaccine very well. And I do have to say, when I survey the people after they get the vaccine, they're all relieved. They just can't believe it. It's just like, it's a weight off of them. Of course, you still mask and you do social distancing, but I guess the fear goes away too about getting really sick. And it's such a highly effective vaccine. It's one of the most effective vaccines ever developed. I mean, it's a remarkable feat that, we were able to do this. I wasn't sure if it was going to happen really, like everybody a year ago, how fast can we develop this vaccine? But they developed it and it's been basically a home run. I mean, everybody has done very well with the vaccine. We are trying to really get this vaccine to the communities that really need it. And we're pushing forward. Union is still vaccinating. If anyone lives in our area, please call us and you will get a vaccine appointment in a timely manner, as well as an appointment for the second dose. So.
And is right there on your screen, Union Community Health Center. I vouch for these folks. They are I do my dentistry there. I've done there's all sorts of doctor's appointments that I've done with them. They're right around the corner. They're a fantastic group of folks. And I certainly vouch for them. 718-220. What's the last 4 digits? It got taken away from me for a second there. 718-220-2020. I should have seen that. It's an easy enough number to remember. 718-220-2020. Particularly if you live in the 10458 zip code, that is their zip code. And I know this because my office is right around the corner. But we have, if you live in the Northwest Bronx, Union Community Health Center should be your provider. It's Federally Qualified Health Center, welcoming to everybody and fantastic place. So we have a lot of questions. I actually wanted to give an opportunity to all of my panelists to come on the screen at once, because we can have all of you available just in case, because there's a lot of stuff here. One thing that I wanted to answer as that happens, somebody asked me, Ms. Lisette Bamenga, is there a plan to vaccinate people who are incarcerated? We know how rampant the disease spreads once it gets into a housing unit. The short version on that is yes. And I'm going to pick up my phone because it literally happened it literally was announced in the last couple of hours, and I was preparing. Let me see if I can find it here. But I was preparing for this, and we found, and it was announced. Here we go. Yes, the state prison system will begin vaccinating inmates 65 and older for COVID-19. Officials said Thursday. And there is so that will start happening. We're going to get details soon. So it was actually that was at 5:38 p.m. that I got that note. So obviously it is happening. And honestly, you have folks who are incarcerated are one of those groups that is at high risk. It is a congregate setting, right? They don't have anywhere to go. They can't really be 6 feet apart from each other. Some of these folks don't have access to PPE. So it's important to make sure that they are vaccinated as well. The impact that them being vaccinated and then not getting the disease also has an impact on not only are there, first of all, they're people, so they deserve to get access to the vaccine, but also they have the folks who actually visit the if it's a jail, for example, they're there, then they leave, they go back to the community. It's important to make sure that we have all these folks vaccinated. So we are probably not going to get to all the questions, but let's actually see a couple more that are here. The first one is I want to actually bring up Lowell. Let me see. Lowell Green, who's a CB7 board member. Are you with us? Let me see.
Yes, hi.
There you go. Good to hear from you. So ask your question, my friend.
Okay, I'm also a member of Statewide for Senior Action. And a lot
Good
of
plug,
things,
good plug.
right. A lot of things that are happening is that a lot of places say, okay, you can go, but only one of you can go. So if you're driving and your kid is going to drive you to a spot, you can't go because, they won't take 2 people or 3 people in a car, which seems foolish if you make a reservation.
So what's your question, my friend?
Well, like if you go to like at Lehman, when you make a reservation for Lehman, you can only make it like for one person a car. And
Okay.
that seems sort of self-defeating, that like you could get a whole group of seniors who don't have any other way to get to Lehman and just get a shot at one time and be done with it.
So your suggestion is that we're more thoughtful about making folks available, making it available for a lot of folks at the same time. Dr.
Yeah.
Ant, if I could ask you to chime in here, particularly since I know that you talked about some of the logistical challenges that exist that you have to deal with as one of the providers. So you can tell us a little bit, maybe you can shed some light on this for us.
Yeah, actually, we do group appointments. We do group appointments for more than one. Now, if there's a transportation issue, I guess we would have to talk to the organization. Usually with the organization and union, we work out how the patients are going to come and get vaccinated, but we do group appointments, and we try to get all the information prior to them coming. So we try to pre-register them all. And you will also get a phone call, a text, and an email of your appointment date. And then a live person will actually call you the same day, because we don't want to waste our vaccine. We want 10 arms for it to go into when we open that vial, the 10 vial. So we make sure that we have the 10 patients, as well as actually 1 or 2 backup. But we do group appointments. So I'm not sure why they wouldn't take more than maybe get some sort of transportation and then get them.
I'll tell you what, Ms. Green, make sure that you connect with us offline so that we can help you with that. Because if you have a bunch of seniors that are ready to do it and are eligible, we want to help you be able to do that. So our next question is actually from Daisy Rodriguez at CB11, and she's a board member there and a community leader. Hello, Daisy. Hope you're with us. But she asked in her questions she sent to us earlier, when will the 1C category open for employees who are deemed essential, but yet fall short in the 1B category and are not currently eligible for the vaccine? If anybody wants to take that. By the way, Dr. Segal, you could come back on the screen, and Betsy, you all could come back on the screen. We could do like a roundabout so everybody's here.
I think it's an excellent question, and I think
Let us see you. Where you at? Where you at?
I thought I'm in the, and I thought I could have my video on. So
Don't worry, keep going. Oh, there you are. There you are. I'm sorry. Go ahead.
So, so it's an excellent question. So, 1A was set up so that we can prioritize healthcare worker. 1B came up because we had elderly 75 plus, and that got extended to above 65. And then the essential workers category was extended. The problem we are facing right now is there is a shortage of vaccine. It is soon going to be relieved. It's just a matter of weeks when this relief arrives. And I'm sure that within a few weeks, we will have the category opened up 1C.
Gotcha. All right. So next one we have, the next question is come from Sophia, who asks in Spanish, but don't worry, I will translate it. ¿Cuántos tipos de vacuna hay para COVID número 19 y nombres de ellos? We already answered this question, but we could go over it. How many types of COVID-19 vaccines are there, and what are their names? And I know, Dr. Zingman, you talked about some of the ones that are available. If you could give us just a quick rundown of those.
Sure. No, thanks for the question. So there are about 9 different kinds of vaccines being developed. The ones in the United States are mainly in 4 categories. So the mRNA vaccines, that 2 of them are approved right now. Adenovirus vaccines, 2 of them about to apply to the FDA, and then two other categories. So certain ones of these, certain categories of the vaccines can be developed faster than others, and so they've made it into the trials and into approval faster.
Sorry, I muted myself there. So there's a few that are in development, as you said, and actually there are also other vaccines available and have been developed in other parts of the world. These are actually available everywhere, but there's like specific countries that have developed their own that are different than the ones that we're getting here. But the ones that Dr. Zingman talked about are the ones that are not only available, but hopefully very soon available. This next one, Betsy, I think you can help us out here. So it's actually, it comes from my colleague's district, Senator Biaggi. Senator Biaggi, I'm not sure if you're watching, but if you're not, thank you for sending some folks our way. One of your constituents asked this question. Carolyn Veith, or I'm sorry if I'm mispronouncing your name, Carolyn, but they ask, how can I better assist senior citizens trying to make appointments for the vaccine? What do you think, Betsy?
Yeah, this is actually a really big issue because so far you have to go on your phone or online and try to make an appointment. So we've definitely seen, folks having issues with that. But right now there will be 41 community-based organizations throughout the city that will be helping folks make appointments. So this just came out today. We were in a meeting with the city. So 41 community-based organizations will be able to make those appointments. So if people want to go there, they'll help them make those appointments. It's going to be specific days and times. It's like 1 hour per day where they'll be able to do it. But they are going to be posting that list on the city's website. Right now, unfortunately, that's the way. The other way is, going on the websites and, doing it on your phone. But again, it is definitely an issue for some of our senior citizens that don't have access to that.
Thank you so much for that, Betsy. I don't know, Lorraine, do you want to chime in on this at all?
I wanted to say that if those services, as she's mentioning, are going to be made available, but I think that if community hospitals overall set up their own services for the community to call directly to make those appointments, it's going to be better, because you have also shut-ins. What is being done for the shut-ins? That's a service that needs to be attended to. But I think that if more direct phone calling, phone banking, and availability is really what's needed at the community level.
One thing that I'll tell anyone who is tuned in to this, and we'll be seeing it in the near future. You can always contact my office, and we can help connect you to somewhere where you can actually have access to appointments. And in the next couple of weeks and months, as the number of vaccines become that much more available, we will, it'll become a little bit easier. And so right there, 718-933-2034. That's kind of like a one go-to place. And again, if you don't live in my district, you can still give us a call. We'll make sure that we figure out where you live. Particularly, I saw that many Bronxites who are in the room. So if you, regardless of where you live in the city, we can certainly help connect you to your senator or to your local representative. But if you live in the Bronx, we'll make sure that we connect you to your state senator as well. And so we have the next one here comes from Guy C. Thank you for being with us, Guy. They ask, hello, Senator Rivera. Is it hello to you? Is it known yet whether or not people should receive the COVID vaccine once a year, like a flu shot, or is getting it once good enough for a lifetime? Thank you. Either Dr. Singman or Dr. Zagal. This is actually a good question. I do not know the answer for this.
I could try to take that one. So we just don't know yet. So that's what I mentioned, that the studies of the vaccine are going to be going on for a long time. One is to be able to figure out exactly that question. How long does immunity last after a vaccine? Do we need a booster? Do we also need a different kind of booster? Because I'm sure many of you have heard about these variants that are around.
Yep.
So it may be that we need boosters that will attack those as well, like we do with the flu shot. The flu shot, there are different strains in it each year based on what's likely to be circulating. We don't know yet, but it may be the same situation.
Perfect. One thing that I wanted to mention, because I as far as Ms. Braithwaite's Heart's point a little earlier about the folks who are homebound, there is unfortunately not a plan that the state has actually pushed out yet, which is quite kind of unfortunate. We have been asking for one. I can tell you that just in the last couple of weeks, last week, when the governor announced that he was going to allow restaurants to reopen at 25% capacity on the 14th of February, he was asked about workers, whether workers were going to be prioritized, because obviously they're going to be, working, they're going to be at risk. And he kind of dismissed the question. The next day, the workers were actually included. So it's a good thing. And then on the issue of people who are incarcerated, just today or yesterday, there was a lawsuit that was brought on behalf of individuals who are at Rikers Island, a class action suit to force the state to actually vaccinate folks who are in prisons or jails. And within a day, it was announced that they were going to do that. So I think that the lesson here is that we need to make sure that we mention it over and over again. And we talk about how serious it is. And in this case, homebound people or homebound seniors, we need to make sure that we get them the vaccine as well. And I am certainly asking and will continue to ask both privately and publicly for the state to make a plan on that available. So put pressure yourselves. It works, folks. Pressure works.
I like this. Can I say one thing about that also? There are seniors who are afraid of leaving their apartment.
Yeah. Because
they're afraid of getting the disease. So they would like to get the vaccine, but they're not willing to go anywhere to get it. So this falls into exactly what you're saying.
So we want to make sure that we do that. By the way, it is restaurant workers that I was talking about earlier, since the governor is saying that he was to open those back up. But next question, we have somebody who's joining us, and we are going a little bit over 8 p.m., but we have plenty of questions. We're probably going to go for about another 10 minutes so we can answer some questions live here and on the air. And that next one is coming from a District 33 resident. Welcome, Carolyn Parker, who is a resident and a community leader. Why don't you go ahead, Rachel, and unmute Ms. Parker.
Good evening, everyone. I want to thank you for all the valuable information. I am a member of New York Statewide Senior Action Council also. I'm on the executive board, and I'm also a member of CWA Local 1180 Retirees Chapter. My question is, I received a text message from Montefiore Hospital saying that I was in the age bracket now that I could receive the vaccine and to call the number. When I called the number, they told me there were no appointments available and I could fill out the form and be put on a waiting list. I did that. Over the next 3 days, I received text messages various times from Montefiore Hospital saying that I was eligible to receive the vaccine because I was over 65. Click on the link. I clicked on the link. When I clicked on the link, I filled out the form. They said that there were no dates or vaccines available, and they gave me a number, and my number was 82,000 something on the waiting list. Over the next 2 days, they sent me another text message again. I was eligible for the vaccine because of my age. Click on the link. I clicked on the link, filled out the form again. I was still number 82,000 something. Now I'm scheduled to go in for another surgical procedure, and I'm going to be in a nursing home rehab facility. And I don't want to get sick while I'm in there or get the virus while I'm in there. So what do I do?
Well, first of all, I'm sorry that you've had to go through this, and it's a perfect example of how we need to be much better about how we do this, and we need to make sure that we create kind of preferably one system that is not that confusing. But does anybody want to chime in here as far as what potentially we could be what should she be prepared for, particularly for the folks that Dr. Segal and Dr. Zingman, because I am not a medical doctor. So if you want to chime in here.
I agree that it is very unfortunate that despite repeated attempts, you're not able to get access from a hospital system. At the same time, I think they may be short of vaccines, and the automated system may be just generating this, so causing this misunderstanding and miscommunication. I think it's best if you're going for a procedure in the hospital, it is best to reach out to the specialist so that they have to do a testing for you before you get the procedure.
Right.
And also, you will need to, Ms. Parker, if you're going to be in the rehab, I'm not too sure whether they can prioritize you, but soon as you reach the rehab, the vaccinations in the nursing home is also active. So based on the facility, the specialist can guide you when you will get it at the facility or from the facility.
Okay.
And let me add,
Yes.
Ms. Parker, sorry to hear about the experience you've had at Montefiore. I know it's actually happening to many people all around the city at many hospitals that they were encouraged to open up systems to be able to let people make appointments, and then they never got the supply. It's been very unfortunate, and it sounds like it's some automated system that just keeps annoying you. Sorry about that.
Can I ask what borough is she in?
I live in the Bronx in Soundview.
Oh, okay. Well, perhaps you'll be able to get the vaccine out at next week
Stadium.
at Yankee Stadium. Yeah, they have over
Maybe.
1,000.
So let me put that slide back up there. For those of you who are still with us, and there's quite a few who are Bronxites, they will be starting tomorrow. You'll be able to get it at the Yankee Stadium, and there should be 1,000 doses, I think, available in the next.
Yes, 1,000.
1,000 in the next week, and hopefully that number will continue to go up. So Ms. Parker, I'm not sure if you can see the screen, but I will read the number to you. 1-833-766-6769. I say again, for anybody who is a Bronxite, this is for the Yankee Stadium vaccination site that will start operating tomorrow. That is 1-833-766-6769. But the website is always, if you have a website, if you have a computer, Ms. Parker, somosvaccination.com. Somos Vaccinations, plural. Somosvaccinations.com. And that would
Okay.
be
Actually, if Ms. Parker, if you can't get it from the Yankee Stadium, you could actually call Union and
go.
we could fit you in next week.
Okay, thank you.
So if you
Absolutely.
don't want, you could actually, that's your name, Carolyn Parker.
Yes.
What's your cell phone?
Oh, wait.
Not
We've
that.
got a couple.
I'll call you.
This is what we'll do. Miss
I'll call
Parker,
you.
Miss Parker, we will actually make the connection happen. See, because
Okay.
remember, if this was, because remember, Dr. On, this is like, it's going out live, might be, and there's like 100
I
people.
hope this is not illegal. I don't know.
No, it was
She's
just,
eligible. She is eligible. So
no worries. I just didn't want 100 people going like, so who's Miss
I
Parker?
know. I'm gonna probably run out. Probably run out.
It's all good, but we will make sure that the connection happens. And for the rest of the folks, that is also something that is available to you, particularly if you are in the Bronx, in the Northwest Bronx, but there are other places that Union, not just in the Northwest Bronx, but they have other locations and other FQHCs, other federally qualified health centers across the Bronx and the city. Also, you can connect with them. This is what they do.
Yes.
They make sure that they connect with community members and they connect them to services. So this is for Union Community, 718-220-2020. But Dr. An will make sure that we connect you with Ms. Parker. Now, we're going to do a couple more questions here. Dr. Bruce Rivera, primo, my cousin. Well, not really. Rivera's like the Smith of the Puerto Ricans, but he's still cool dude. Like him a lot. Have not seen him in a while. Good to know that you're here with us. Dr. Bruce Rivera and Lisette Bamenga asked a very similar questions, and they asked that they asked how we can ensure the vaccine is being distributed in an equitable fashion. And this obviously, Ms. Braithwaite Hart spoke about this earlier. That there was a story, and I think that they were referring to a story that just happened last week, where there was a location, a vaccination location, open in Upper Manhattan. And there was a reporter, and I want to make sure that I shout her out, Josefa Velasquez. Josefa Velasquez is her name, from The City, which is a publication, an online publication. And Josefa actually did a little bit of digging, and she found that the number of people who were going to this Washington Heights vaccination location, most of the people who were there were actually from outside the city of New York. From outside Manhattan and outside the city of New York. And then the most of them were actually not people of color, not brown or black folk who were from those neighborhoods. And so the story actually made it so that they changed it to make sure that we have locations that are specific for particular geographies. I don't know if you want to chime in, Ms. Braithwaite, about some of the efforts that you and the NAACP are actually involved in to make sure that equitable distribution happens.
Oh, again, that is the exact same issue, same point. There was a vaccination process being available at a church in Manhattan. They announced it to the congregation, but because it was on the web, it was open for anybody to see. By the time that the congregation decided, oh, this is available, those from out of the area, out in Westchester and everywhere else, showed up, and you cannot turn them back. They could not say, oh, no, this is for our people. That was not the deal. So they gave them the vaccine, and the next time around, they made it so that it was strictly for that community. And that is what happened in Washington Heights. That was New York Presbyterian. That Saturday, when they first opened it up for 65 and over, my husband was there, and I was waiting for him in the car. And he said, I'll be out shortly. And I said, you must be the only Black person in there, because every car that has shown up is a Caucasian person, elderly. I said, and this has to be the same 65 and over group. He said, you're not kidding. I am the second Black person in here. The place is full, and there's only two of us. Washington
Bet-
Heights is primarily Hispanic,
Yeah.
right? But the Hispanics that showed up didn't have an interpreter. So many of them left. So the language barrier is another issue that we have to address in this.
Yes, and that's actually, yes, and actually, Betsy, I wanted to pass it on to you as you talk about this, because I know that's one of the issues that the Spanish Federation is dealing with.
Right.
Yeah, sure. And we have, we're trying to get, right now we have this Vida project, and part of it is where we're supporting FQHCs so that they have the manpower to be able to speak to people in different languages. So we're able to support those outreach efforts and education around the vaccine in different languages. But I think that's part of like the effort in terms of like opening up, for example, the Yankee Stadium is to get, you have to live in the Bronx, you have to be a Bronx resident. So I think the city, mainly the city right now is kind of like trying to get around this. We've heard talks of even mobile units and to get the vaccine to folks that cannot leave their homes. So these are things that are happening, but definitely it wasn't just Washington Heights. Like we've seen it even in Harlem Hospital.
Oh, yes.
And the thing is that we have to get folks to be able to make appointments, not just online and clicking and phone. It has to be for people to walk in. But the city is aware, and I know the state is also aware. And again, Senator Rivera, you mentioned like talking about it. So we have brought it up, and they're working on being able to get folks to make sure that people are being vaccinated for the people that live in those areas.
This is certainly a work in progress, and I know that both you and folks at the Hispanic Federation and NAACP are doing a good job at making sure that we are aware of it. The folks at Let's Get Immunized are making sure that the efforts are there. So as we bring it in for the end, I wanted to do a kind of like lightning round of the technical questions, because there's a couple that I wanted to just have people be able to hear from them, particularly because they're talking about the variants. A couple of folks asked about the variants, and I will, and while you think about just quickly addressing that, somebody asked about the list of 40 community-based organizations that will be helping seniors, and we'll make sure that we get that list of 40 community-based organizations. Betsy, you're going to make sure that we get that from you, and we'll make sure that we have it available in my office. We'll also push it out via social media so that folks have access to it, because those local organizations, they're trusted members of the community, right? So that is incredibly important. So we'll make sure, Lisa Gilman, you asked that question, that is for you. But as far as the variants are concerned, I did want to like, would the vaccines work against the variants, and talk for a couple of minutes about the variants, since it's a technical question that we wanted to make sure that we addressed.
So, I'll try this one. So there are different variants, and different vaccines may work differently against them. So the right answer is that it depends on the variant, and all of the vaccines that are available now and are in development are being tested against these different variants. So we know that some of these variants, the vaccines that are available now work. Others, for other variants that are tougher, some of the vaccines that are available right now don't work as well, but still work at least half the time. So not optimal, but that's also the reason why there is such an urgency to vaccinate as many Americans as possible, as quickly as possible, because if you can only get more mutations, more variants by people having the disease. So we have to lower the numbers.
That part is incredibly important when you're talking about, and this is like, this is the nerd in me, the science nerd in me heard about this, and it just made sense. Like mutations always happen, right? There's always mutations and slight changes that happen over time in any type of living organism. And there's mutations are the ones, in this case, the more people have the disease, the more likely a mutation is to happen. And most mutations are basically harmless, but there's some that might make it even, make it worse and make it, but for the moment, thankfully, we have found that all the variants that currently have been found are the vaccine works on them as well, correct?
All the vaccines that are currently available work at least somewhat on all the variants that have been identified so far.
Gotcha. So,
And Senator, I just want to
go ahead.
intervene and chime in. And even if they work little less effectively than 95%, but they reduce the moderate to severe disease. So the infection, the complications become much less. And Dr. Zingman is absolutely right. The variations will come. We will learn a lot more about them. The important thing is we get vaccinated, we reduce the disease burden on ourselves and our community and the loved ones around us.
Gotcha. Last question for the evening, and we went way over, but I'm very thankful we still got so many folks with us. So last one is from Bridget Kelso Anthony, and she asked, I'm going to throw this one to you, Dr. An. I am a relatively healthy 53-year-old female with no underlying conditions. She is not a frontline worker. She is a minister and an adjunct lecturer working from home. When can she expect to receive the COVID vaccine? What do you think?
Actually, she's kind of on the borderline because she is an educator. So I think if you are an educator, you would be considered a teacher, which would be a frontline worker. So you would be able to get the vaccine because you would qualify as an essential worker. So I'm kind of bending slightly about that, but I would say she is an educator. So, I mean, she is working remotely, but she still would qualify because she would be considered an essential worker. So
obviously there's a push and pull between opening up to new categories sooner. You want to open to new categories sooner. But on the other hand, you need to give the other people a chance to get it. So you could easily just further overwhelm the system where instead of Caroline being 82,000, she's 182,000. So
it's a tough question.
We have to get more vaccine.
Yeah.
That is the only solution to this, more vaccine.
I mean, it's a very hard question because you're rationing the vaccine essentially, right? And you're giving it to the high-risk people first. And what happened was we were almost too tight 6 weeks ago because we were sitting on them for healthcare workers. And I had a ton of vaccine that I couldn't give because my employees didn't want them for about 3 weeks. And I was waiting for the other, because the first A was just healthcare workers and long-term healthcare, if you live in a long-term care facility, that was it, 1A. 1B happened, that was 75 and older. And then actually we're in 1C, but only part 1C. We're on 65 and older, but we didn't allow less than 65 with chronic medical conditions that put you at risk for, COVID-19 complications. We haven't gotten there. So we're kind of part 1C. Right. But I think that second group is a huge number, like 80 plus million. So we don't have that vaccine to give those people. And that's what it is. It'll be pandemonium. So
supply is important. And we should mention that the President Biden has made it a priority to provide that, to increase that supply. And there will be sending vaccines directly to pharmacies. So as the categories become a little bit broader, then we will make sure that it will be also available there. So listen, I want to bring this in for a landing. I want to first of all thank each and every single one of you that has hung out with us. We still got over 80 people here, and I don't even know how many we had on Facebook. This is an incredibly important thing. I am glad that you are here. There's some things that I want to make sure that you take away from this. First of all, vaccines are safe. They are necessary for us to be able to get to some level of normalcy. And they will be available to you either already or at some point soon. And I know that when I become eligible, I will certainly be getting it. I know that some folks who I'm looking at on the screen have already received it. I know that some folks who are tuning in have also received it. But we understand that there's legitimate questions that people have about this process, about this vaccine. And I'm hoping that what we did over the last hour and a half, 2 hours, answered a lot of these questions. I know that it probably didn't answer all of them, but make sure that when you're seeking out information on this, you do so from credible sources that are trustworthy. And these community folk right here who you're looking at, whether it's Dr. Segal, whether it's Dr. Zingman, whether it's Dr. An, whether it's Miss Braithwaite, or whether it's Miss Morales, these are trustworthy folks who have who serve the community that you all live in, and they know how important it is that we get this done right. So I want to thank Let's Get Immunized New York, who has been an incredible partner through all of this. I want to thank all of my panelists that I just was there, as well as Señor Carrera and Señorita Casas, who have been translating all of our words. And I want to thank again all of you, my constituents and folks who have tuned in from other parts of the state or other parts of the city. Make sure that you get immunized in your corner of the world. Share this with other people who you think might need the information, and make sure that you contact us with anything that we might be able to help you with. I am incredibly glad that we got to do this evening. Now, thank you so much for your time. You have a wonderful night. Thank you all for joining us this evening. Take care, folks.
Good night. Thank you for having me.
Bye.